Hey guys, I just want to say that this video is going to be kind of filmed in two parts. Like, one is mainly me when I originally filmed the video, but then I filmed a couple of updates. That I filmed the main part of the video several weeks after I had my first jab, but then I filmed a little update after I had my second jab. So yeah. So if this stuff seems a bit weird, like if I've said, "Oh yay, I've had my first jab. I can't wait for my second." I've had my second, but like that was past Danilo, and this is present Danilo who's had both his jabs. So yes, I hope that makes sense. Enjoy the video. Oh, also, I'm just gonna include some posts that I posted on my Snapchat story the day before, and then I'm gonna include some posts um on Snapchats that I posted the day I got the vaccine. So I'll include them at the end. But yeah. Hey guys, I hope you're all well. It's been a very stressful day, not gonna lie, but also my hair looks awful. I'm really sorry. I cut it myself, and it was a stupid idea, and it looks awful. Like, it just looks really bad. But anyway, I've been wanting to make this video for the past 3 weeks, more than 3 weeks. And I kept procrastinating because this video means a lot to me, and I'll explain it why later. But basically, 3 weeks ago, more than 3 weeks ago now, on Wednesday, the 5th of May, 2021, I got my first dose of the COVID vaccine. And on Thursday, the 3rd of June, which was about 10 days ago, I had my second jab, so I am now fully immunized. Yay! Basically, I got vaccinated, and I got the Valneva one as part of a clinical trial. So I'm just gonna explain. I'm gonna make a full video, like talking about the Valneva vaccine, and a full video talking about the clinical trial, like in the future, like in like I don't know, a couple weeks or a month or so. A clinical trial is just to determine the safety and efficiency of vaccines or drugs or new treatment. And I signed up to be part of the coronavirus vaccine clinical trials. So I'm going to talk about first, but before I talk about that, I'm going to talk about the Valneva vaccine. So the Valneva vaccine is a vaccine which is in phase 3 development. So they started phase 3 development in April 2021, with about 4,000 volunteers in the UK. And it is what makes this vaccine different from other COVID vaccines is that it is the first, and I think so far only, inactivated virus in Europe. So you get injected with an inactivated form of COVID-19, which cannot make you sick, and it can't replicate, so it's not dangerous. But it just treats your body how to fight it, obviously. So then it makes you immune to it, or it should do. So basically, I had signed up for several COVID-19 vaccine trials since last year. I think since like June or July last year. But I didn't get selected for any, so I was like, oh, I really want to help the world. I really want to make the world a better place. So I signed up for a chlamydia vaccine trial, but I missed the deadline. And then when I saw that they were doing the Valneva vaccine trial, I wanted to be involved. I really, really wanted to be involved. I really wanted to help, because the more vaccines against COVID-19 that there are in the world, the better, because some will be more efficient than others, and the more that are approved, the more people that will get vaccinated, and that will help save lives all over the world, help hospitals from being overrun, and help herd immunity, and just end this pandemic, and allow us to go back to like normal life and hugging and clubbing, etc. So I really wanted to make a difference. I really wanted to be part of this trial, so I signed up, and they called me, and I booked my first appointment, and I went in. And I'm going to talk about the full process like another day, but basically, before you get given the vaccine in this clinical trial, and I think most clinical trials, before you got given the vaccine, they do lots of tests. So when I came there, they were really, really nice. I thought I'd be really stressed, but I was actually really relaxed. They just asked me questions about like if I had any conditions, if I was vulnerable, if I took any medication, which I do. I take antidepressants. They then did a COVID rapid test, which was negative. If the COVID rapid test had been positive, then I wouldn't have been able to get the vaccine, but it was negative, so I was able to. They then did a COVID antibody test, which was negative. Then they did several other tests, like they asked loads of questions. They did a physical examination, and they did blood tests, and they did a urine test, and they were really sweet. They were really nice, and they asked loads of questions. And when everything was fine, they saw that I was healthy. Like they measured my weight, etc. They saw that I was healthy. They said that I could get the vaccine, which I was really happy about. Usually in a clinical trial, about half of the participants get the vaccine, but the other half don't. They get a placebo. However, in this clinical trial, what happened is a third of the two-thirds of the two-thirds of the participants, or roughly two-thirds, like you have a 2 in 3 chance of getting the Valneva vaccine, 2 doses of the Valneva vaccine. You also have a 1 in 3 chance of getting the Oxford vaccine. I think, guys, so I actually got that slightly wrong. It's actually you have a 1 in 4 chance of getting the Aztrazeneca vaccine, and a 3 in 4 chance of getting the Valneva vaccine. Sorry, I don't know why I did the math wrong. I was really tired. I'm not usually that bad at math. I think it's so that still as many people as possible are vaccinated and are able to get vaccinated. So instead of doing a placebo or the vaccine, they did the vaccine in a clinical trial and the vaccine that's approved. However, I know for a fact that I did not get a placebo or the Oxford vaccine, the AstraZeneca one, because they are not allowed to give it to you if you're under 30. So in this clinical trial, if you're between 18 and 29, you just get given 2 doses of the Valneva one. You don't get given the AstraZeneca one. But if you're 30 or above, you get given AstraZeneca or Valneva, and you won't know which one. So they gave me the Valneva one. They gave me the first shot, and I didn't have any major side effects. And on Thursday, the 3rd of June, I had my second jab, so I am now fully immunized. This one was also fine. I had pretty much no side effects, other than like tenderness on my arm, but that's like to be expected. But yeah, it was completely fine, and I was just really happy to be fully immunized. But yeah, I've been waiting a year and a half, well, not a year and a half, but like 15 months to be protected against coronavirus, and I finally am. So yay! So that is awesome. But I'm not going to speak too much because I usually speak too much in videos. So I'm going to shut up now. But yeah, you download this app, and they give you all their contact information, and you download this app and you log your symptoms. Like you log if you have any side effects, etc., and also if you like get any if you get any COVID symptoms. And so then I was just logging any side effects that I had, but I didn't have any major side effects. I don't think I had any side effects because I had a couple of teeny ones, but I'm pretty sure that they were unrelated. Like if they had happened to me, if I had not gotten the vaccine and I had these teeny side effects, I would not have noticed. But I didn't have any ones. Like I know loads of people who have had bad reactions and bad side effects to vaccines. I thankfully didn't have any, so that was good. And yeah, I was just so happy to get the vaccine. Like on my way back, I was smiling because when I was on my way there, I was so sure that like something would go wrong and I wouldn't be able to get the vaccine because when I applied to be a sperm donor, I got rejected because I am autistic and they're not, which in my opinion is a very stupid rule. But anyway, and I was scared that I would be rejected because. I was really scared that I would be rejected because I take medication, but thankfully not. I was able to get it, and I was so happy. I had not felt this happy since I had my first kiss at the very end of 2019. I was so happy on that day. Like that's why I kept procrastinating making this video because it means so much to me. Like it means so much to me to have gotten the first vaccine because obviously I assume if you've watched some of my videos or if you know me in real life, you know that I've been struggling with really bad depression for the past year and suicidal thoughts. But another side of my mental health that I have not talked about so much on YouTube is my OCD, which got really bad, obviously, which was already really bad, but in the pandemic it got much worse because usually I'm told, do not wash your hands so much, you don't need to wash your hands so much, you don't need to be so scared, and then suddenly when the outbreak happened, being told to wash your hands again and stuff like that, it just made me very anxious. It's changed a lot how I live my life. Obviously it's changed everyone's life, but like I can't even like if I can't touch any door handles in my own house, it's really bad. So getting the vaccine just means so much to me because I've been wanting to get the vaccine since March 2020. I really, really, really wanted to get the vaccine, and I just really wanted to help. Like, I really want to help them develop new vaccines, especially because with Valneva, Valneva is my favorite, especially because one of the reasons that Valneva is really good is that it's likely to be variant proof, which is really good because I know that variants are a big concern to the whole world. But it's meant to be variant proof, which is really good. It's already showed positive data in phase 1 and 2 trials. So I'm really excited. I'm so happy to be part of this. Sorry, I'm stuttering so much. It's just because, today's been a really bad day. But then thinking about getting my vaccine on the 5th of May, 3 weeks ago, I was so happy. The UK has ordered 100 million doses of Valneva, and if all goes well, they're probably going to the Valneva is going to file for like approval regulation in the UK and elsewhere in the autumn. So it should be it should be rolled out like at the end of this year or early 2022 or both, and it'll probably be used as booster jabs. But yeah, I'm just so happy to be part of this. Like, I really want to help the world. Like, I feel like I just want to make the world a better place. So much. I want to make the world. I want to end suffering. I want to save lives. I just really want to make the world a better place, and I really want to end this pandemic, which is awful. I just really want to make the world a better place. Like, any way I can. I really, really want to help make the world a better place. And I'm so glad to be a part of that. By the way, I'm getting my second dose next week, Thursday, the 3rd of June, and I'm really excited about that. Guys, sorry for the noise, but I just had my second vaccine. Yay! This is the clinical trial, place, if anyone was wondering. By the way, for those of you asking, why do we need so many vaccines? We already have Pfizer, we already have Aztrazeneca, we already have Johnson & Johnson, Moderna, Novavax, if that gets approved, etc., etc. The more vaccines that there are, the better. Also, there will be some vaccines which, for example, might be suitable more to one age group than another age group, and there'll be more vaccines that, some vaccines that are more effective. Like, for example, a vaccine being developed in Australia, has now shown to be one of the first vaccines in the world that completely stops transmission, which would be the best because the less transmission, the better, because that helps with herd immunity and it helps stop people getting sick, not just getting less severe symptoms. So the more vaccines that there are in the world, the better. Also because the more that there are developed, the more people that get immunized, the more herd immunity, the quicker this pandemic ends, etc., etc. You know, we all want to get back to normal. We all want to go back to hugging and having in-person less lectures. Well, not everyone, but a lot of people. And I want to go back gay clubbing. I want to kiss hot guys. I want to hug my friends, etc. Maybe I should include this in this video. Oh well. So yeah, I just wanted to help so much. I really want to help any way I can. I want to donate my blood. I want to donate my organs. And I was just so happy to be part of this clinical trial. It's one of the best things ever. So yeah, I'm so happy. Also, one of my favorite things is that in the summer when, because a lot of people I know have been vaccinated, but not a lot of people my own age. So in the summer it's gonna be funny because when my friends are gonna be like, I got Moderna, I got Pfizer, I got Aztrazeneca, though they're not giving Aztrazeneca anymore to under 30s. But anyway, they'll be saying that, and I'll be like, I got one that hasn't even been approved yet. Hey, I am such a loser. Been meaning to upload this since the day I had it, but on the day I had it, I was so happy when I got home. I was so happy. I was so happy. I got vaccinated before my parents, which is quite well, it's not shocking, but it's quite. Well, which is quite I don't even know the word for it. They only got vaccinated recently because my dad's 40 and my mom's 39, so they're quite young, so that's why they didn't get vaccinated, and they didn't have any underlying conditions, and they weren't NHS workers. But yeah, I was so happy the day I got my vaccine. When I got home, I was so happy. I made roast dinner for my family, and then my friend George and I I went in his car and then we went to IKEA and then we ordered McDonald's. I was just so happy. I've not felt that happy since late 2019. But anyway, this video is already super long, so I'm gonna stop talking. But yeah, I'm just really happy to have been vaccinated, and I'm gonna do full videos about the Valneva vaccine, just the full clinical trial and why you should be part of it. But if you would like to be involved, please do. The more people, the more volunteers there are, the better. You will really be helping end this pandemic and making the world a better place. So please do get involved if you can. I'll include a link down below on how to join. But yeah, thank you for watching. And yeah, I'm really happy to have been part of this clinical trial. I feel like I'm missing something. Like, I feel like I forgot to include something in this video, and I don't know what it is. Oh, this is why I was procrastinating making this video. But yeah, I wanted to post this because it means a lot to me, and I also want to encourage others to get the vaccine, obviously, and like, if I can encourage even one person to be part of this clinical trial, it will really make a difference. So, and I'm also just, it means a lot to me. Like, I feel really happy to be part of this clinical trial. I feel like it's one of the best things that's ever happened in my life. And also I'm always posting, I feel like I'm always posting depressing stuff. So I want to post more. Like, I feel like I'm always talking about when I'm sad, so I want to talk about when I'm happy. So, I mean, I'll be honest, right now, I'm not really that happy, but, at the time, I was really happy. And if it gets improved, I'll be really happy as well. But, yeah, anyway, thank you guys for watching, and I hope you have a lovely weekend. I don't know why I assumed I'm gonna post this on a weekend, but anyway, I hope you have a lovely, whatever day it is, and bye. Guys, just one last update. It turns out that I'm pretty sure that they finished recruitment for the phase 3 trials, so I'm really sorry that I hope I haven't raised anyone's hopes of getting involved. But now their vaccination program has expanded to everyone aged 18, so if you're 18 and over, please get your vaccine. Also, I forgot to say, this is my vaccine card, and yes, it is different from the NHS vaccine card. That is because this one is a clinical trial. And as you can see, if you tick where it says Valneva or Aztrazeneca, because you tick whether you've definitely gotten Valneva or whether you don't know which one you've got. And since I'm under 39, I got Valneva, so yeah.